Deputy Program Manager of the National Malaria Control Program, Dr. Kezia Malm, says a major challenge to the program is inadequate attention for hospitals, thus lacking bed nets. Now, treated nets are one of the key intervention programs in the fight against malaria.
Insecticide-treated bed nets are a form of personal protection in the fight to reduce malaria illness and death from the disease in malaria endemic regions. In this regard, free bed nets have been distributed to many people in Ghana. However, this has not gained much attention in the use of treated bed nets in the hospital. Deputy Program Manager of the National Malaria Control Program, Dr. Kezia Malm, in an interview with TV3 said this is a major challenge.
Each person sleeps in the net comes with its own issues, physically. So if you don't handle it well, you may be introducing infection from one person to the other by using the nets in the hospitals. The hospital must be in a position to be washing each time somebody moves away. That's why you don't see it in all hospitals.
She added the program would explore other measures to eradicate malaria at the hospital level.
What we also try to promote for the fight against malaria is housing, in terms of making sure that you have the netting in the windows. And for the hospitals, I think that's where we try to push more, because that's much more feasible. Eventually, we'll look at other ways of fighting against malaria in the hospitals.
From 2008 to 2013, between 3.1 and 3.5 million cases of clinical malaria were reported in public health facilities.
We're still staying on malaria, and Ghana needs massive financial support to achieve its target of ending malaria in 2020. The Ministry of Health and its stakeholders are calling for support from private entities.
Malaria is a leading cause of deaths worldwide.
The funding is not enough. If you look at our strategic plan that we launched last year, which is supposed to take us to 2020, we still have a gap in funding. For example, if you look at interventions like killing the baby mosquitoes or larvicidin, we are currently not undertaking that. But it's something that we want to do to make sure that we tackle malaria at all angles. So there is definitely a gap for us to be able to achieve malaria elimination in future.
At the 2016 National Health Summit to commemorate World Malaria Day, Dr. Kezia said the National Malaria Control Program was working with private partners to scale up intervention. 3.2 billion people, representing half of the world's population, are at risk of getting malaria. Deputy Minister of Health Victor Bampo said donor support for malaria eradication became a lower middle income country.
The fiscal space is tight, and it's tight because a few things have happened. Primarily that things have changed since Ghana became a lower middle income country. So development partners used to contribute much more significantly to our health sector budget. And that was when we had the sector budget support and so on. Now, because we have become a relatively more resourced country, a lot of it is falling on us. And I think donor support has gone down to something like 19% or less.
Director General of the Ghana Health Service, Dr. Apia Denchra, was hopeful if Ghana invested in the environment, the country can achieve its target of ending malaria by 2020.
The ambition is to end malaria, and we believe that it can be done. It's a matter of everybody investing in that direction. First, we need to invest in our environment to ensure that we don't keep standing waters around. We clear our bushes. If we do that, then we reduce the mosquito load.